Hey guys, I think it's maybe like day 5. So this morning, so anytime you get a hysterectomy, you have to go through a couple of like pre-op appointments, or even if you have pelvic pain, one of the procedures that they do is called an intrauterine ultrasound, and they basically take like this big giant stick, shove it up your crotch, and it's an ultrasound. So, First, they do an exterior one where, it's just like if you were pregnant and they would put it on the outside of your belly, and it's just making sure that all the things are in the right places and if there's any abnormalities. And then, the funny part is you go in, you feel really awkward. You're like, oh my God, I need to shave my legs. I hope I don't smell. Oh crap, wonder if I'm on my period. Can they still do it? Yes, yes, and yes. So, although it's a little bit messier and they would probably prefer that you're not on your period, but sometimes being on your period can give an inaccurate reading. So they would usually prefer it to do like right before or right afterwards. And of course, yes, it's definitely a lot less messy, but, I've had to reschedule in the past, and usually it's up to the discretion of the patient. So just because I don't feel like bleeding all over the place, luckily I was at the tail end of my period for this month, which seems like I'm, always on my period. Anywho, so you go in and they pop you down on the table. They put a pillow under your butt and they ask you a series of questions, which they're not embarrassing. They just want to make sure that you're understanding why you're there and why you're getting that procedure done. Because you'd be surprised on how many people don't understand why they're having to do something in order to accomplish whatever it is they're accomplishing. And sometimes they even ask because if you don't know what you're getting done, they're going to tell the doctor, and the doctor needs to explain to you like why you're getting something done, and also to make sure that you're doing it willfully and not against your will. Last time they asked me, do I feel safe at home? Do I feel this? Do I feel uncomfortable? And so usually there's like those kind of standard run-of-the-mill questions, which are also still important, but sometimes people just don't really think about that. So after they lay you down on the bed, they do like an external ultrasound, and then they have you have to have also a full bladder for this. So you have to drink 32 ounces of water in the hour leading up to your appointment, because your bladder has to be full for them to actually see everything that they need to see, which of course you're pushing on my bladder. So of course I have to take a piss. And then, after they're done with that, the external one, they walk you to the bathroom. You're able to pee. Thank God. They bring you back in. They have you buck naked from the waist down, and they stick this big giant probe. It's probably, I don't know, like yay long. It's a good like 16 to 18 inches long, but they only go in maybe like this far, which, I mean, technically speaking, is about 8 to 10 inches. Honestly, it's about like the same. It's this typical size of a dildo. So, and then they ask you the question, have you ever used a probe before? And for shock value, I just want to be like, sure, it's the big black one I have hiding in my underwear drawer. So today, for some reason, I said, yeah, it's like riding a bicycle. So they put it up into your vagina, and they kind of like, do the whole joystick thing where you feel like you're a video game, and they take a whole bunch of pictures, and then they take it out, and then they say you're done. They wipe you all off, and then you're good to go. But going back to the reason why they do it is just to make sure that they're getting good pictures before you go in for your surgery. It's standard procedure. If they don't give you one, it's kind of an odd request to not get one done. So if you're going through this process and you're having to go through it alone, make sure you ask questions and or have someone there that can help you remember the questions that you need to be asking. Most of the questions that are asked is why I'm having to do this. And it's just to get pictures before they go in and do the surgery, just to make sure that there's nothing that's pressing that needs to be addressed sooner. Because sometimes it might be like a month and a half to 2 months out before you get your surgery. And for some people, it might be as much as 6 months, depending on how their health is. But it's also getting ready for your pre-op exam, like your pre-op appointments. And for some, if you have pelvic pains like I do, anything that gets jammed up in there, you're going to feel uncomfortable. There's cramping afterwards. When they are in there and they're moving the probe around, there are some uncomfortable instances where it catches your breath. But that doesn't happen to everybody. Usually when you have pelvic pain, you get the discomfort afterwards. It feels like period cramps. I mean, it sucks. And don't ever let them tell you, oh, it doesn't hurt. Yeah, it feels uncomfortable, but like at what level do you feel the discomfort? If you need to, you can take some Tylenol about an hour before you go, and that usually helps. You can take Motrin if your doctor allows it, like whatever medication. I just wouldn't recommend taking narcotics before you go, because obviously you have to drive. So if you were the lucky few that get to have narcotics before you get your surgery, just don't take one before you have to drive. So for obvious reasons. But I mean, today was okay. It was usually I get really teary with those kinds of appointments, because I get really uncomfortable and it's awkward, and you're sitting there with just a thin millimeter blanket sitting on top of you, and it's just uncomfortable. I think I'm getting to the point now where I'm more numb about the subject, but I haven't been talking about it that much to anybody, and I just feel like if I talk about it, I'm asking for attention. Or I'm craving attention, or I need support. But I mean, I just don't want to seem like I'm a selfish person and I'm trying to talk to everybody about it. If someone asks me about it, I talk about it, but I'm not actively trying to bring it into a conversation. But we'll see. I've got my blood tests I have to get done, and I have to see about my pre-op scheduling appointments. They're supposed to call me by the 12th. So that's the other thing that you have to do. If they don't call you to set up your pre-op appointment, they usually give you a certain date to call by, and if they don't call, then you need to call in and set up that pre-operative appointment. But you will always have a pre-op appointment, and it's from doctor to doctor on when they want to do it. Sometimes they like a week before. Some doctors, it's like a couple days, and then for other doctors, it can be as much as 3 weeks. So it just depends on the doctor and depends on the procedure. But, I think the closer that we get, the more nerve-wracking I'll be. But I don't know. I'm just kind of about it right now. I'm just going to sit on my bed and rewatch, the Twilight series. So go Twilight. All right, guys. Till next time. Bye.